Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, Clarissa, so tell me what's going on with your jaw and your headache.
I've had years of TMJ since I was 6. I was diagnosed with jaw locking,
Mm-hmm.
and ever since then it's progressing. My face has been shifting to the right. I have a lot of tension in my neck, my jaw right here, and also along my shoulders in the back.
How long, you said like 6, you were 6 years old.
I was 6 years old
So
when my jaw started locking.
About how many years now?
I'm 20, so
Okay.
about 14 years.
14 years.
Yeah.
So during that time, tell me like briefly, what kind of treatment did you have?
At first, I got some physical therapy. After that didn't work, I
Okay.
tried an appliance.
Okay.
And then as we progressed the appliance, it didn't work and it started making it worse.
Mm-hmm.
So after that, I went to physical therapy again.
Mm-hmm.
And now 2 years later, I'm here.
Okay. So you had appliances, you had braces.
I had braces as well, yeah.
Okay.
2.5 years of
physical
braces.
therapy. So how much pain do you feel from 0 to 10 and where do you feel it?
Right now I'm at a 4 right here. It's getting to about a 5 since I haven't cracked my body throughout the day, and this is going to about a 5 right here, and as well right there.
Is that considered constant or
It's constant right now. It's like slowly getting up there, increasing.
So since you were 6 years old, you've been having this constant daily pain in your jaw, and you have tension headache.
Yeah, and when I get stressed out, my muscles get really wacky and they tense up even more, spasm even more.
Okay.
To the point where in high school I used to get such bad headaches that I would throw up.
Oh.
Yeah.
Okay. So do you have like the headache on the side and the back, or in the front? Where do you feel the headache?
So right now I have tension here and here and right here. So that I would crack my head this way to relieve it, and then I have it right here. So I would twist my back this way and this way to relieve this.
Okay. And any other symptoms do you have? What's difficult for you to do?
It's hard for me to chew solid foods.
Okay.
I can't open my mouth and constantly move it.
Okay.
It's difficult for me to just talk a lot or move my jaw a lot without feeling a soreness later throughout the day or the morning.
In your jaw.
Yeah.
So you have a limited range of motion in your jaw.
Yeah.
In your TMJ. Okay, so I'm gonna take your range of motion, and so have you ever had like locked jaw?
Yeah. I had lockjaw when I was younger. It stopped after 2 years, and it started. It didn't lock, but throughout high school, it was getting to the point where I couldn't open my jaw very much. It was like right here.
Is that how much you can open?
I can open like that.
You let me know everything pain free. Just make sure you let me know if you feel any pain. Okay.
Okay.
Okay. So I'm gonna take your range of motion for your jaw.
Okay.
And actually, before that, let me see your range of motion for your neck. So move your neck to the left and right. Okay, and let me know if that's it's a little bit tight on the right. Okay, extend, flex. Okay, side bend. Okay, how much pain is that aggravate your symptoms?
Yeah, I'm going as far as I can without aggravating it. This way is really bad.
So you see tight side bend and rotation to the side, actually.
Yeah, it's really tight right here.
Okay, so let me take your range of motion for your jaw. So open your jaw. 35, 36. It's almost 37 degrees. So is that your norm? Or have you ever been able to open it wider?
With a couple, I remember when I was doing physical therapy the first time, we got it open a little bit more, but it's just...
So this is 37. Normal is 35 to 45. Some people like their normal is 45. So I just want to know, is that your normal?
that's normal. Yeah.
So most of your pain here, yeah, in this area, like this area, and here. Okay. Did anyone work inside your mouth, like physical therapy?
No.
Okay. Sure. Have you had any accident, trauma, or any injury?
When I was younger, I did a lot of sports.
Mm-hmm.
So I did karate, so I was kicked in the jaw a lot.
Oh.
And
Is that like you? How old?
oh, I was young. That's about around the time that my jaw started locking.
Okay.
And I did gymnastics too, so I did fall on my face a lot.
Really? Where do you remember like an accident that you really had bad bruises?
No, nothing that is really bad bruised.
Mm-hmm.
That hurts.
Too much. Make sure it's very free. Okay. Mm-hmm. What about now?
Oh, that's a little.
Sorry. Mm-hmm.
Oh,
Sorry. Mm-hmm. Mm-hmm.
a little painful.
Okay. So did you have any area like you really remember you had bad injury?
Nothing. I mean, I remember I was sparring with my sister and she kicked me in the jaw.
Here.
I don't know what side it was.
Mm-hmm.
I don't remember.
Mm-hmm.
I've had a lot of accidents. Yeah, nothing that's really like, oh, I had a bruise on my face.
Okay. Sorry.
Right there.
Was that painful?
Yeah.
Okay. You feel the tightness? Like this? It should move like this. You feel the movement here?
Uh-huh.
You feel here. It's not really moving much. Sorry. Is it okay?
Mm-hmm.
Okay. More about here.
It's tightening up my left when you do that.
What about here?
No, it's fine there. Oof.
Sorry.
Oof. Hey.
Pain?
Yeah.
In the same spot or you feel it in different spots?
Here, and then it got to my ear.
Ah, okay. You're really tight. You feel all the tightness?
Yeah.
Mm-hmm. What about now?
That's fine.
Okay.
Sore there.
Mm-hmm.
Oh.
Oops.
But when you move it, it's not.
Yeah, that's where you have really severe tightness. Relax. So most of your pain here or here?
Here.
Okay. All over there. Sorry. You feel those knots here?
Oof, yeah.
So, let me know if that's too much, okay?
Okay.
Too much or it's okay?
It's okay.
Okay. How's that?
It's fine. Soreness.
Soreness in those spots. Yeah? A bit too much?
No, not too much.
Okay. Right, really tight. Okay, so I'm gonna work on your scar tissue, okay? You feel this?
Mm-hmm.
Like grinding feeling here?
Yeah.
That's a scar tissue. Here. Let me show you in your hand. You feel how nice and smooth here?
Yeah.
That's normal compared to this. Can you tell the difference?
Yeah.
Sorry. Make sure it's not painful, okay?
Okay.
Relax, relax. Feel that bumping?
Mhm.
Okay. Is it more on the left or right?
It's more on the left. My right one is the one that they say released. The little, you know how like your jaw has that little padding?
Oh, the disc?
Yeah, the disc. That's where they say it released. So my left side's trying to compensate for what.
What do you mean the release? It's displaced?
It's displaced, yeah.
Oh, man, okay. When did that happen?
I don't know.
So that's the dentist.
That's the dentist who told me. Yeah.
Sorry. Let me get the right tightness here. You feel that grinding here? Okay. So it's displaced on this side.
Yeah.
Are you comfortable that I work inside your mouth?
Yeah.
Okay. Okay, thumb up if you feel any pain, okay? And do not bite me, okay?
Okay.
Alright, open. Close. You feel the tightness here?
Mhm.
Okay. How's that?
Sore.
Make sure it's not painful. If you feel the original constant pain, as long as that pain does not increase,
Okay.
that's totally fine, okay? But if it's okay, so you feel how nice and loose this area
Mhm.
and this,
Mhm.
how nice and loose here. It's a little bit tight here. Okay, sorry. A bit too much? Oh, okay, there you go. Compared to this side, this is very tight. Okay. And here, I feel the tightness here.
Mhm.
Sorry. You feel all that tightness, yeah?
Mhm.
Mm-hmm. Now you start to feel the release. You feel that now?
Yeah.
Feel how nice and new and loose now?
Mhm.
Mm. That's really nice. Okay, let's do the other side. You feel the tightness?
Yeah.
In there? Okay.
Mm.
Sorry. Feel this band a little bit?
Yeah.
Okay. That should not be there. I did not feel a band here.
Mhm.
That's a very restricted and tight fascia that's compressing everything. The constant tightness that you were experiencing before, do you feel it or it's gone?
No, it's gone.
Okay. What about the headache and the tension in the neck?
Yeah, it's gone.
Mm-hmm.
Yeah, I don't feel like I need to crack anything anymore.
Okay. So let's actually move your neck left and right. Look at that. That's actually much better. Look at that. It's a good range of motion. It's a little bit tight here. but you get more range of motion. Can you tell the difference in the neck?
Going down especially.
Mm-hmm.
Yeah.
And going further.
I got a little crack on that one.
Mm-hmm.
And then this one's
Crack is okay. That sound will disappear when I release more.
okay.
As long as you don't feel pain, that's fine.
Okay.
You have that crack feeling because our joint should have, like, especially the spine, should have a space between the joint.
Mm-hmm.
This is normal. I'm just exaggerating just for visualization.
Okay.
When you have a lot of tightness in the muscle or scar tissue or fascial restriction, that space decreases.
Okay.
So when you move, things rubbing, that's when you feel that cracking. But when we release it, the space will start to open, so your joint will move freely.
Okay.
So as long as you don't feel pain, that's totally fine.
Okay.
So let's open your jaw and tell me how's that feel.
Good. It doesn't feel like I'm trying to overextend it right here.
Okay. So we're gonna work on something because I'm gonna do more work because I noticed you have a little bit shifting.
Mm-hmm.
But that might take us a few sessions to really get everything in normal alignment. So I will have you stand up, facing this way. So your range of motion was 37 when we started.
Mm-hmm.
So I wanna see how much is now. Wow, that's 45. 45.
Oh.
So your normal is 45.
Okay.
So.
That one felt a little pressure,
Mm-hmm.
but not as much.
Can you tell the difference after the treatment?
Yeah.
So what do you think about ASTR treatment?
It works very well. I didn't think my cheeks could feel like. I didn't know that like my cheeks being like that was tight. Tense. Yeah, I didn't know that.
Yeah.
And now I feel the difference.
Yeah.
It's good.
Yeah, that's good. Thank you.
Thanks.
Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.